So you've treated a lot of patients. Have you seen people's mentality affect their results?
For instance, a musculoskeletal condition like a shoulder issue or a knee issue, and the first thing out of his mouth is, nothing you can do with my shoulder, because it is what it is and it's going to be this way. He's already made his mind up. I'm not sure we're going to get the right results, not to the level that maybe I would expect for that patient, because some people just have to be sick. They just have to have a condition. But I want that perfect patient to want to get better. I have patients who walk in and they start, look at the step I can take. Look at this, I can stand from a seated position. That's the best part for me. The letters and the testimonials, and I know we all do it for social media now, but it's really in my heart.
Today on our podcast, I'm excited to welcome Dr. Leisa Grgula, a chiropractic physician with nearly 3 decades of experience helping patients heal without medications. Dr. Leisa earned her Doctor of Chiropractic degree from the National University of Health Sciences, and she's the owner of Accurate Care Medical Wellness Center, an integrative clinic dedicated to providing proven alternatives to drugs and surgery. At the clinic, she leads a team of physicians who focus on regenerative therapies and personalized care that respects each patient's values and goals. Beyond her clinical work, Dr. Leisa is a seasoned TV host and columnist for various outlets exploring important health topics. And welcome to the show, Dr. Leisa.
Thank you. Thank you so much for inviting me.
Yeah, so I'm so excited about our conversation because I know you have a wealth of knowledge helping patients using innovative and alternative methods to focus more on drug-free recovery, right? You do use medications in your practice, but a lot of it can be done without drugs. And so why would you choose that kind of approach?
A lot of it depends on what the patient wants, because they've gone to their medical physicians, they've gone to practitioners who maybe have over-medicated them, and they've got side effects they're just done with. So they'll come to us just to try something else. And I listen to that. And another reason I like that we have both in our practice is that they don't have to hide anything from their medical practitioners. And that happens a lot, more than I ever had known. So they won't tell them that they're receiving acupuncture, chiropractic, stem cell therapy. Sometimes you just don't know. But if it's all under one roof and they're getting their medical care and their alternative care, there's no reason to hide it.
Right. Okay. I'm curious because I've been in the US for over 30 years now. And I remember when I first came to the country, how me just mentioning acupuncture, because I came from China, right? That's just part of how you exist, is that you embrace both Chinese medicine and Western medicine. So to me, is a no-brainer. You know, we know sometimes acupuncture and Chinese medicine works great, and sometimes Western medicine works great. So I didn't have any prejudice when I came. But when I started mentioning Chinese medicine or acupuncture, I was in San Francisco. That's supposed to be more liberal and open place, right? But people were looking at me like I'm just weird, you know, very strange out there, right? But that has changed a lot. However, there are still prejudice that's existing. So what do you think are the common myths and misconceptions about alternative medicine?
First, that there's no science behind it.
Yes.
We have to try harder. And even as a chiropractic physician, we have to try so much harder and work harder at science behind what we do. And we have to do that, especially for insurance reimbursements, et cetera. And when it's with acupuncture, there is science behind acupuncture. Acupuncture's been around, as you know, since the Stone Age. So it wouldn't be around since the Stone Age if it wasn't working. And when people say to me, I don't believe in acupuncture, usually my answer is it's not a religion. There's nothing to believe in. It's a science. So,
but what's interesting, the same people who say, I don't believe in it, when they have intractable aches and pains and nothing helped, and then they went to an acupuncturist, all of a sudden it's like a religion. They have a conversion and now they are a believer and they're telling everybody about it.
Thank goodness.
I see that. Yeah.
I do see that too. And I've seen it over the last 30 years. And I love what I do because I can turn the light bulb on for them. And when the bulb goes on and they get it, it's such a good feeling to me. And that's really why I'm a physician. I like it.
Yeah. So I do see, part of the change in how we're looking at alternative medicine is that there are successes. It's the successes that are driving this movement of acceptance. So if it doesn't work, then it's not going to be accepted. But it's shown over and over again. And I've, had, seen many people who say, oh yeah, I'm a believer. I'm a believer in acupuncture, in Chinese medicine. And of course, me personally, my mother. So when someone says, I did a post about TCM, traditional Chinese medicine, and somebody commented on social media, said, I can't believe you're talking about Chinese medicine because it's pseudoscience. How can you as a medical doctor promote it? And I said, you are speaking from ignorance. Yes. It's just pure ignorance. You don't know the thousands and thousands of research papers that have been done on all these therapies and showing, even clinical studies, controlled clinical studies showing the benefits. And of course, I have my own mother that's incontrovertible. From my own mother who was diagnosed with multiple myeloma when she was 43 years old. So I was 13. I thought I was going to lose my mom, that she had maybe 2 years to live. And she lived in the hospital for 6 months, literally among all these cancer patients. There were about 10 patients in a huge ward. And she was there for 6 months, 6 rounds of chemotherapy, and her veins were all blackened, and she fainted multiple times during the chemotherapy. And then most of her, roommates, in the ward mates, they walked in and then they were carried out on a stretcher dead. So she decided, this is not working. I'm miserable. It's been 6 months. I'm out of here. So she left. Where did she go? She went to a Chinese medicine doctor. And this doctor specialized in immune health. So, there are different specialties in Chinese medicine too. So he looked at her, with, the tongue and pulse and looking at her constitution and gave her a prescription of, I don't know, 20 different herbs and probably animal parts. And then me and my dad went to a Chinese medicine store and they put
it's
in
like a pharmacy.
Oh, absolutely, it's a pharmacy. It's incredible. And so they put this concoction and put them in little parcels. So each little paper bag contains all the herbs you need to brew. It's horrible. Smells horrible. Tastes incredible. Whoa, it's the worst. But the Chinese medicine have the saying, the best medicine is bitter. So they believe in this tasting horrible is probably really good for you. That's all she did. She drank this potion morning and night and then did some aerobics in the morning. That's it. 1 hour in the morning, went to the playground, did aerobics, and then drank this horrible thing. Nothing else changed. And within 6 months, all her markers went back to normal. She went back to work and lived for another 32 beautiful years. Beautiful. So that's, and it's so shocking, her progress, because the doctor's like, how? So the doctor, who's the chief doctor on the ward, came to our house asking my mom, what did this Chinese medicine doctor give you? Because I need to bring this back to my ward to give it to my patients. So that's like an illustration of East-West integration, right?
The interesting thing is it's specific just for her. So it's not like he can bring all those little bags for anyone else. So he was still using
Western medicine mentality, thinking, oh, this one brew is going to heal everybody. But everybody should get their own brew.
Yes. Yeah. I've done it. And it has done miracles for me. Performed miracles for me. And even with the accident that I had with my shoulder.
What kind of miracles has, you're talking about Chinese medicine?
Well, the herbs.
The herbs.
I've done herbs myself.
Well, how did it help you before?
The most recent one was when I fell and I damaged my shoulder and tore everything. I had fractured 3 bones in my face and I had awful scarring and bruising. And obviously I was being watched by a maxillofacial surgeon to ensure that the bones weren't displaced and I would need surgery. And they did not displace. It was perfect. So I went to my Chinese herbalist and she read the tongue. She took the pulse, everything. And I took the herbs, and the maxillofacial surgeon could not believe that he would call it runaway healing. And I would go in every 2 weeks and his staff would see, in the beginning it was weekly, his staff would look at me and say, how in God's green earth did you heal so quickly? Swelling went down, the bruising went down that fast. Yeah, like it didn't happen. And I was going to post all of that on my website, but I think it was pretty graphic. So,
wow. Yeah. So at the time, did you also use stem cell therapy for healing of your face?
I had my stem cells. I did an IV push.
Okay.
And we did exosomes. And that was miraculous as well, because that in combination with PRP and ozone at that time, and an hour, exactly an hour, I was at a red light on my way to that maxillofacial surgeon's checkup. It felt like my skin, when you go to get Novocaine for the dentist and it starts coming back and it tingles, an hour later I felt it.
Oh,
and
wow.
I told him, and we talked about that for a little while, very fast, within an hour. I'm not
Yes.
saying that I was healed in an hour, but I could
Things
feel
are
the
happening.
changing in 60 minutes after that.
I've heard that from my patients as well. Of course, I have seen people swelling. I mean, that's visible, right?
Yeah.
Swelling go down within 30 minutes of a stem cell infusion. And I remember the patient came in, like she couldn't make a fist. She had rheumatoid arthritis.
Yes.
And during the infusion, that's really within 20 minutes or so after an infusion, she made a fist and started crying, because that hasn't happened for, 2 months. So
powerful.
it can
Yeah.
be very fast.
Yeah, and I like it. And that's why I did it. And then when my patients see that story or hear the story and I talk about it, I just have to be careful, because we are not all the same. We don't heal the same. We don't respond the same. I'm a quick healer, quick responder. I'm very uninflamed.
You probably have improved or optimized your system to the point where
Absolutely,
your
yeah.
regeneration is always ready. A lot of people's regenerative potentials are stagnating because they put junk in their body. They're not moving their body, so things are just not ready to go.
It takes time. And they say also exercise. And because I'm an amateur bodybuilder, when you tear and build, the body gets that message, oh, it's time to build this back. And that's what one physician had told me in the field. So that could be it as well. I don't know. We still get great results in the office. I just have to be careful not to promise the results that I get and as quickly as I get them. And some of my patients do.
Yeah.
They really do. And a lot of it, we were talking before filming, it's what's between the ears and the mind.
Right.
If you want it to happen and you're willing to work with it, it's an innate process.
So you've treated a lot of patients. Have you seen people's mentality affect their results?
Absolutely.
Okay.
And as we were sharing earlier, just for instance, a musculoskeletal condition like a shoulder issue or a knee issue, and someone's spouse is in my reception area, and maybe the wife will say, now I want you to see my husband and take care of him and fix that shoulder. And the first thing out of his mouth is, nothing you can do with my shoulder, because there's nothing. It is what it is, and it's going to be this way. He's already made his mind up.
Yeah.
So if I were to do anything regenerative, any stem cells, ozone, even if I did acupuncture, I'm not sure we're going to get the right results. We'll get results, but not to the level that maybe I would expect for that patient. And are they even expecting results? Because some people just have to be sick. They just have to have a condition. And that's okay. That's who they are. But I want that perfect patient to want to get better, to want to respond. And they just don't have time for the trips to the doctor, the trips to the pharmacy, the pills, the side effects, the downtime after the surgery, etc. That is, the patients who don't want to deal with it is a perfect patient for me. So it's absolutely their attitude.
So you've seen on average people who have a positive attitude, believing that they're going to get helped, they have better results compared to people with negative attitudes.
And they're so excited about it. I have patients who walk in and they start wearing their arms around and walking real quickly. And look at the step I can take. Look at this. I can stand from a seated position. And my other patients, they'll jokingly say, do you pay them to say this while we're sitting here? Really, it's happened. I have a few of them who do it. And so then, of course, we'll get the camera, the phone out and start to video, because they are so excited. That's the best part for me, because as a physician, sometimes we need to hear that. We need to know and see. We can know their progress objectively, but when subjectively someone just is over the moon and feeling so good, you see they're losing weight, their skin is clearing up, they feel terrific, and their personalities are so much more open. It's the light bulb going on. I love that. So
right.
That's one of my favorite parts of practice.
That's true. Yeah. I think that's what keeps up going, right? The inspiration and the excitement in our patients.
Yeah, the letters and the testimonials. And I know we all do it for social media now and for promotion of our practice, but it's really in my heart.
Mm-hmm.
And there are days that I'll just see that and say, oh, I forgot how great she did on that. And I have patients who stay in touch with me. One woman is actually traveling around the world right now and put me onto one of those social media profiles where I can follow her and she can share her results and or not her results, but her activities with me. And that's someone who's brought me into her life because I gave her the ability to use her hands again in her knee and what she can do with her family.
Right.
These are really cool things that we do now.
Right. And you also share your own healing story, right? So one of the remarkable stories is the healing of your shoulder. The reason it's remarkable was because you actually completely tore your tendons.
Mm-hmm.
And
the supraspinatus and infraspinatus in my shoulder,
right,
and the subscapular with retraction, complete tear, and then the subscapularis underneath was partial tear. Those are 3 of the 4 rotator cuff muscles.
Okay,
yeah.
So right away after injury, you got your MRI, right?
Correct.
That's what it showed.
Yes.
And then what did you do?
Well, first thing I did was the physician I had consulted with wanted me to go to Chicago from Scottsdale, go to Chicago Rush Presbyterian Hospital and have it replaced by a specialist who specializes in difficult cases because I'm also a chiropractic physician and I need my shoulder. So it wasn't an option for me to not use this. And it was an option
to replace the tendon,
to replace the whole shoulder. They wanted to do a shoulder replacement. Oh. Yeah, the whole thing. My MRI went on for 2 pages.
That's a big
Those
deal.
Were just the beginning. Those are number 1, 2, 3.
They want to take your body part out.
Yeah, that's an amputation. Then patients don't really understand that. You can't get a shoulder replaced, try it out for 6 months, and put the old parts back in. And they don't think that through. Okay. They're sawing bone, and it's gone. That thing is gone. Or those bones are gone. So the joint. So when they put that new shoulder in, I work with people after they've had surgeries. I've seen them in the gym. I've seen them in my practice. I've seen some go very well and I've seen some go not well at all, failed surgeries, and the downtime and all the things that they have to go through. And when I saw that in my mind, immediately I said, gosh, I don't want to do this. We do stem cells here. I want to do it. So I consulted a friend of mine, a colleague who's a researcher, and I asked him, I said, please be honest with me. Am I wasting my money by purchasing product, having it done, and then still having to go to Chicago? And he says, no, try it. If for some reason it doesn't and you're not comfortable with the results, then go to Chicago and have it done.
Exactly.
Use it as plan B.
Yeah.
And I did that. I never went to Chicago. I had my first injection about maybe 4 weeks or 3 weeks. I'm sorry, about 3 weeks after the injury. And I'd fallen running is what happened. And I hit the curb. It was horrible. Yeah. And I broke my sinus, my orbital, and my temporal bones. It was pretty damaging. Yeah. And it was rough. So, but I didn't have any retinal tears. Luckily, the universe was watching out for me. So I did more than I would have for the average patient because this was not an average condition or situation. So I initially went in with Wharton's jelly and exosomes. And then
so you did an IV infusion?
I did an IV first of the exosomes. That's right.
Okay.
And I did that on the same day as an ozone injection. And I never did injection into the face ever.
But you inject into the shoulder?
We injected into the shoulder.
Okay.
But that first IV was the initial thing that we did. And I did an IV push. I didn't, but my nurse practitioner did.
That's the one you felt the tingling?
Yeah, within 60 minutes. And I was sharing that. I was at a red light on my way to the maxillofacial surgeon. He was watching me weekly in the beginning and then every 2 weeks to watch those bones to make sure I didn't need some sort of facial surgery. And I did not. So that happened. I got the tingling, and I tell patients that it's like when you go to the dentist and you've had Novocaine and it starts to come back and you have that tingle. That happened exactly an hour after my IV.
You're waking up a nerve ending.
Yeah, it was beautiful. And I was so excited. I didn't realize how numb everything was until things started coming back because I had other worries. I had the face to worry about, the shoulder to worry about, my patients, my practice. There were a lot of things going on. Yeah. So an hour after those exosomes went in, it was just miraculous. Because it just brought that inflammation down so quickly.
Did you do the ozone at the same time?
Yes,
that you
did.
The IV? Okay, so you put some ozone in your shoulder.
Well, our protocol is to do stem cells first. We're going to say stem cells, the regenerative products. And then we do 3 separate injections, if it's a shoulder, knee, whatever we're treating, of ozone and PRP. the patient's PRP. And then in 2 months, we kind of ride that healing wave. We do the stem cells again and exosomes.
Okay.
So it's a total of 5 injections over a 2-month period. And it may
So
be
that's
weekly.
what you did?
I did that.
So,
well, I did it a little quicker because I had to. I didn't have time. And I had the time, I had the effort, the energy, the brain. I didn't have time for this to be down. So I had not gone back to upper body gym until, my first injections were in early June, late May, and then to early June. The second round of stem cells was in July. And normally I would have waited the 2 months, but my body told me I was ready. I wanted more. And I said, okay, let's go in more. I ordered them, got them.
So you did the ozone first, but you also did stem cells.
PRP stem cells first. With,
okay.
Stem cells and with the exosomes. Then PRP and ozone, 3. And then my body wanted to not wait the 2 months, and I went in with the second injection of Wharton's jelly and exosomes.
Okay. So the first time you just used a PRP injection. Second time you used stem cells.
Well, stem cells, PRP, and then stem cells again.
Oh,
that's what we do.
All right.
And we separate them. I never put PRP with the stem cells. It's at a different time.
All
That's
right.
just
So
how we
you
do
have a different
it.
approach than mine. But so
I wanted that, and I felt good. But then in August, and every once in a while, I'd have the nurse practitioner put the ozone in. I didn't, and I'd had some PRP. It wasn't as necessary in my mind because I was following my intuition on this one and what I needed. So by August, I did the third stem cell and exosome injection. And after that, my body said it was over. I didn't have any more.
Okay, so just within 2 months, you did 3 injections?
Exactly. Yeah,
Okay.
it was 3 months, and it was 3 instead of 2.
When did you notice a difference?
I was back in the gym doing upper body by August. I'm sorry, late August, and I was swinging a golf club.
So
September
within 2
15th.
months, you went back to the gym.
So May, June,
within
July,
2
August.
months
Yeah,
of
within
injury.
3 months of the injury,
Okay.
I was swinging a golf club. And they said that
Wow.
if I didn't get the shoulder replaced, I'd never swing a golf club again. How's that?
Wow.
That was
I would have
wonderful.
advised you not to swing the
Of course
golf
you would.
club. Yes.
But it felt good. I mean, I
Because
wasn't.
that's a common mistake people make. They feel
soon.
so much better, but the tissue is still healing. It's not the final product.
And I know that,
but you couldn't help yourself.
I couldn't. And I was putting and chipping back on Labor Day. But by September 15th, I said, let's try this. And there was no pain. And that is always not indicative of full healing. And we know
Exactly.
that. So the average patient, don't listen to that. Listen to your doctor. But I just had that innate feeling to do it. Now, I wasn't playing 18 holes. I wasn't playing every week. But the fact that I could do it was miraculous. And then over time, over the months, I worked back into playing again.
Yeah.
And by the following March, I did another, because the researcher, my colleague, he said, let's do the MRI. He was chomping at the bit, couldn't believe we got the results we did. And then we got that MRI, and it showed growth and it showed change. It was wonderful. And then in a year later,
I just want to comment on the speed of healing when it comes to stem cells, because one of our doctors actually got amazing help from stem cells and exosome infusion after a very traumatic surgery of the face and the oral cavity. When she was extubated, her throat was kind of filleted, the trachea. So they ended up, telling her that she probably wouldn't be able to swallow any solid food for 5 weeks. But after stem cells and exosomes, within 7 days, she was swallowing and eating normally. I mean, the speed, right? That's astounding. So
the inflammation that comes down and the signaling to the body to make the changes necessary is expedited. And this is the one thing too I wanted to mention today, is that patients will come in and say, oh, I already had the surgery. It's too late. I don't need stem cells. I've already had the surgery, whether it's shoulder, knee, musculoskeletal, whatever it might be. That's not true, because we can do it, as you know, as an adjunct to their healing. Yeah. And that is miraculous. It's just, it speeds things up and it makes things go properly and makes it happen.
The pre and post surgery stem cell or whatever regenerative medicine therapies is just so powerful, because I see it. It's common, and I'm sure you see that too. It shortens the healing time to about 1/3, or at least half of what it would usually take. But to 1/3 of what it would usually take, that's a common thing. It just speed it up so much. Not only that, your surgical site is going to be better. The scarring, right? Going to be less scarring,
Scar
better
tissue
formation.
Yes.
Yeah. So everything is going to be more complete. The healing is, you're going to just have better formed tissue. Yeah. So it's not just.
Don't discount it. If you've already had surgery, it's okay.
Yeah.
And we've worked with failed surgeries on shoulders. I have a wonderful patient story. He'd gotten it done about September one year, and he got the anchor on the bicep tendon. And the surgeon said, you'll get 95% of your motion back. It was like 5%. We actually had 2 of those, but this guy in particular has done so many videos because I run into him at some car events and he's waving his shoulder around. And so we just grabbed the phone real quickly. But he's doing so much better. And now he's a year out after getting the cells. He's playing drums again. And this guy's about 68 years old, I think, and just so active and feels so much better. And the initial surgeon wouldn't even do another MRI. After 9 months after he'd gotten the surgery, he still had same level of pain and same decrease of range of motion he did before the surgery. He was so frustrated. Then he came to me. He knew me outside the practice. He said, please, can you help? We did it. And he's over the moon with it now. So it can go for failed surgeries because that would constitute a failed. Failed surgery doesn't have to mean that it was bad and wrong and something was a mistake by the surgeon. It's just that the outcome didn't come out as promised or as expected, or maybe to not the same level or something else also could go wrong. And then you get another condition altogether that you never had going into the surgery. But what I'm seeing more is just surgeries that just didn't get the same results or the results that the patient wanted, and neither did the surgeon. So rather than going in and doing another surgery, which is usually the option from the surgeon, these patients now have another alternative to come to me.
Thank God.
Then get this done.
Isn't that nice to know?
And then they're still working and doing the things that they love to do. So they get their lives back that way.
Right. And there's no downtime. And that's just incredible about it. But I want to come back to your shoulder.
Okay. Yeah.
So torn tendons, completed with retraction, which if you ask any orthopedic surgeon, they will say, absolutely. If it's retracted, there's no chance that those two ends are coming together. But what happened to yours?
I don't know. And it's not showing up in the MRI objectively, but it did in the 7-month one. And it showed the growth and the changes. And when I got
there's
one,
partial reattachment.
Yes, you'll see it in the report, and it's just growth of the tendons, so that they could see that it was a certain measurement. You know how they measure it was the same radiologist who read all 3 films as well. So that was nice, and she's an expert, and I've known her since 2007. So it was good to have that continuity, and I even went to the 3rd MRI at the same facility as I did the first one. So we got through everything that way, and everything was more continuous anyhow. So it's not that it says you have a perfect shoulder again, objectively, which is what the report says. But what I know subjectively, I'm doing things, which is a great thing with stem cells. It's fixing things that were broken or torn, damaged way before my accident. So for instance, I always bring up dips in the gym and the dip machine. And I haven't been able to do those since 2018 because I have a degenerative shoulder. I'm a chiropractor. And there's an old saying, it's not if we get bad shoulders and we have to lose our practice or our practicing, it's when. And in the beginning, when I graduated 30 years ago, there was only one company who would write our disability insurance because of our shoulders.
Wow.
So we have bad shoulders. And then you put bodybuilding on top of that, we have a problem. So my MRI reports are all 2 pages long. We're just sharing the top 4 things out of about maybe 11. Okay. So we don't worry about number 5 after. We're looking at number 1, 2, 3, and 4 from my accident. So I'm able to do dips. And I had a trainer in the gym look at me. He said, what are you doing? And this was last December. And I said, dips. And he said, we haven't done those. And we did the math 2018. So it's fixing old stuff.
Yeah.
And that's what I'm loving. So when the patient comes in and they're pointing to that bicep tendon here, sometimes the injector will actually, the physician or the nurse practitioner will pepper leftover with PRP or ozone. If there are leftover product with stem cells, not usually, but they'll put it somewhere else. And by the guide of the MRI, by the guide of the patient's subjective findings.
Yes.
And it's fixing. And signaling the body
Yeah.
to fix better things
Yeah.
that they need as well. That's the coolest part.
Yeah. So did your MRI reading become shorter?
Well, the old stuff, no, because she mentioned everything. She
she's
had to
still-
say
she's
what
still
was the same, which
tracking.
was not. Yes, she
Yeah.
tracked everything. But yes, as far
But
as
there's
what was wrong.
objective improvement
Yes, there
on
was
all of them.
objective improvement.
Yeah.
The third one, not as much. It was strange. 7 months after, it showed more of
Mm-hmm.
the improvement on the MRI than it did the year after.
Right. So
Actually,
it's
no,
stabilized.
it's 2 years later. It's 2
So
years.
basically the improvement stabilized.
Mhm.
And
Yes.
whatever the new tissue that's formed has gotten so strong that the body believed the healing is done, right? They didn't have to
Yes.
reattach more of the tissue.
No.
So functionally, you actually felt stronger a year after
So
comparing to
stronger.
7 months after, right?
Stronger than before the accident.
So, right.
And that's what's so unique.
Ah.
So it's my subjective, how I feel. And granted, I haven't trained as heavy because it was almost a year of not doing the same, lifting the same weights. My weights are almost back to where they were. There were a couple of moves that I'll do or certain activities that just, they're shut off. And I don't know why that is, like with cable crossovers. So I'm having to build that back up a little more. Things are surprising me, but that and how I practice and how I adjust. And we don't do really a high velocity, low impact. I do more of a decompression and pumping of the table. And I had to go to the left side of the table from the right and do that after the injury. I'm back to how I was practicing before.
And you
just
mentioned the shoulder that got injured now is doing better than
It's
the
my
one
good
that
shoulder.
never got injured.
It's my good shoulder.
That's pretty
and
amazing.
I didn't realize how bad this one was until now I know how wonderful this one is. So if I'm going to pick up something heavy, if I have to lift something up over into a shelf, I'm using the right shoulder.
Yeah.
And I like that, but I'm not stupid with it. And I don't press too much. But here's something that my patients also share with me. And I had a gentleman come in, I think it was Wednesday or Thursday, probably Wednesday. And he said he's gotten both shoulders, both knees done because the more he gets, the more he wants. His mom's come in, his mom's friend has come in. They're great referring patients. And he said he fell the other day and he had some little gash on his head. He does doors. He installs doors. He repairs large doors. My doors in my acupuncture rooms are custom 450-pound doors. And this is what this guy does. And he says he has to get on his side on the floor. He was unable to do that before the stem cells we put in. And now he can. And he's one comes in waving the shoulders around. We've got him on video. And he said the one thing that he loves to hear, and this is what I do too, loves to feel, is that when you do re-injure something, it used to take maybe, oh no, what have I done? This is 2 weeks to get better. I've got to nurse it. I've got to treat it. I've got to massage it, whatever. Then you find after the stem cells, I know myself, I got a little nervous thinking I re-injured something. I tore it off again and it was an hour. And then it got better.
Goodness.
Now it's 10 minutes. And now I got it. And that's what Dan said. He said, I got up off that floor and he says, in a day, it was like it never happened.
Wow.
He said that never would have been. He said, I wouldn't have probably been able to work for over a week or two.
See,
Yeah.
he went back to closer to how he was as a kid. Because we injure ourselves all the time as little kids.
Yeah.
The crazy things we've done, right? I jumped off high fences and, fall off trees.
You bounce back like Rubbermaid.
Yes, exactly. So that's what we're trying to give to patients is the awakened potentials.
That's a
because
good way
we
of
got
putting
these
it.
new young cells that remembers how to do this. Yeah.
That is a great way of putting it because I never put the connection of being like a child again. Yeah.
Yeah.
But the first thing, and I will share with patients and people out there, is that it's just our human nature to think Western medicine. They'll ask me, when is this going to wear off? When is it going to stop? Because you took that pill and it wore off. You got a steroid injection and it wore off.
Yes.
This is different. And when you do these little re-injuries and they just heal so quickly and they don't hurt, 10 minutes later, I can now take a breath. I was trying to put something back on my hot tub with my landscaper one day and I tweaked my shoulder. Oh no, what have I done? Leisa, get over it. I get over it. And it felt a little tweaky for maybe 10 minutes and it was gone. So
Wow.
I now accept it myself because I'm still a patient. So that's the big change, that it's not a shot that you get that's going to go away.
Yeah. Yeah,
That's
exactly.
really fun. Yeah.
I tell people, hey, if you don't injure your shoulder again, you're done. You're fixed. However, you will be aging, right? We're all going through the aging process. No one so far has escaped death. So why are we dying? Because the system are all shutting down. So if you want to slow down that process, then you may want to do some upkeep. And stem cell therapy has been shown to revert your body back to a younger state. And in animal studies, extending lifespan by about 30% consistently in rats and mice, and not just extending their lifespan, but health span. They look better fur. Their capabilities of being running around is better, and their mental capabilities.
The perfect placebo. They don't even know what to expect.
Exactly. And then when they actually dissected the brain and muscles of these animals, they showed that everything, all the markers of aging, that everything that's supposed to be going either down or going up in the markers was reverted to the younger levels. So that's objective evidence that on the cellular level, in the tissue itself, that these are younger tissue. So it's just powerful. Yeah. So we were just bringing it back to the younger tissue level. Yeah.
I see it. I see it in their face. I see it in their eyes. Not necessarily that their age is looking younger, but their joie de vivre, their joy is younger.
Yeah.
You know, when a patient comes in and feels sorry because they're old and they're in pain and I'm so old. I don't like to hear that. We don't allow that in our office, you know. And then to have that type of a patient turn around and feel so young and really have a different attitude.
Yeah.
It's nice.
Yeah. And I want to mention about the MRI reading because it really illustrates a really good point, because a lot of people are over-reliant on MR readings, including the doctors. But you don't treat imaging, right? You treat the patient. So the fact that your MRI, so you did 2 MR readings after your stem cell treatment. So the first one showed great improvement, right? But then it was not fully healed. But the second one after treatment wasn't that different from the first one. But subjectively, you were actually doing better. You feel more complete healing. So how do you explain to patients when the imaging is not showing that much difference, but boy, you feel great?
Exactly what you said. We don't treat the MRI, we treat the patient. Listen to the patient. Surgeons out there, listen to the patient, because there would have been many surgeons who would have even at that point said, let's replace the shoulder. I'm sure they would have.
Wow.
Because even though I was doing well and I felt well, and you could see it in the gym, you could see it on paper, not on paper, but in life, but didn't see it on paper. Don't be so attached to the imaging. And the radiologist told me that. You have just told me that. I know that as a physician, to just step away from a minute and realize, what is my lifestyle? What is my life? What am I doing? And what am I able to do now? And what am I willing to give up? Surgery can go wrong. Not every day on every patient and every surgeon, but every day there's someone going wrong. But what if? What if people can die on the table? You may never use your shoulder again. These are side effects that are all those pages that you sign. It's right there. And those are the informed consent. If you really read those, it's there and that's real. So are you willing to do that when your shoulder, look at mine? It was fine. Why would I put myself through that and open myself up to that? So try to trust yourself. Try to trust your healing. Trust the stem cell process.
Yeah.
That's what we're doing. Trust
and
it.
there's one study I want people to be aware of, because it's such an elegant study, because these are for people who had taken a lot of steroid and they had bilateral knee deterioration. So then what do they do? They split the patient in half. So one knee, they did the surgery, knee replacement. The other knee, they gave a stem cell injection. So now you have the same patient, half is stem cells, half is knee surgery. So that's 30 knees. So 30 patients, that means 30 knees that got surgery and 30 knees got stem cell injections. So out of the 30 knees that got surgery, 6 of them ended up having to have revision surgery. And when you have to go back in to revise it, that means things didn't go well, right? They have to make it better, to cut again. But out of the 30 knees that got stem cell injections, only one actually needed surgery in the end. This is after years. Yeah. So that just shows you, out of the 30 knees that actually got cut and got a new part, right? Got amputated in a sense. It didn't really have to happen because you could have saved, you didn't have to change the whole.
But in that surgeon's office, it did have to happen. And that's why I practice alternative medicine, because I want to give them an alternative view. And patients will come in and say, I talked to my surgeon and he or she said, stem cells are not going to help me. Stem cells won't work. I have been a chiropractic physician for 30 years. This is my life. People will come to me and say, excuse me, my medical doctor says chiropractic isn't good for me, or I don't need this care, this treatment plan you put me on. I need surgery, medication, injections, not stem cells, but steroids, etc. And I have been trained to tell them, when you get a second opinion, go to another specialist of that specialty. So if you're looking for an eye surgery, you're not going to go to a podiatrist for a second opinion. You're going to go to another eye surgeon. So please go to another stem cell facility, an integrated place, someplace that does regenerative medicine, and let them tell you yes or no if that's a second opinion. The surgeon probably isn't as well versed. The surgeon probably doesn't practice regenerative medicine and stem cells, and that's not their specialty. No more than I will tell you if you have to have a surgery. I will give you my opinion as a chiropractic physician who saves people from surgery every day. But ultimately, it's that surgeon's decision and your decision as to where you want to go. But just go to another physician who does this for a living and has for a while.
Right.
That just
right.
give yourself the ability to make your own decision.
Yeah. So in your practice, what kind of treatments have you seen that makes the biggest difference for patients? What are your go-to?
Well, for stem cells or just chiropractic and acupuncture, all the different things
Just all the modalities that you're using.
I would say right off the bat, as a chiropractic physician, I do Cox technique, and I'm one of only, I think right now there are 3 in the state of Arizona, the only one for 30 years. And what we're able to do with the pumping of the table, not the typical high velocity, high or low impact ballistic adjustment. I can do those. I've been trained in them. This is totally different, very scientific. It decreases intradiscal pressure. So we want to release the pressure that's in there and relax that patient. So we want to be able to decompress because they've been compressed, and we're able to bring that disc matter, actually the gel, back into the disc. And that's huge. I save people from surgery all the time, and I work on failed surgeries. So chiropractically, that's huge for me. It's just after 30 years, I'm finding my shift in practice to go more toward the regenerative and some of the other things. With my acupuncture, also with psoriasis, migraines, what we're able to do with that.
So just hold on one sec. So were you kind of decompressing the spine? There's a machine. Are you
It's not
holding?
It's a table. And so on my website, on the homepage, there's me doing a video of me doing it.
So you're
patient is prone, and
okay.
I will contact the spinous process, the little bumpy parts of the spine for the people watching. And I hold that, and the table, it only takes 60 millimeters of mercury to decompress a disc. So we don't have to bring this table all the way to the floor. It is not painful in most cases. It's very comfortable, and it's nothing you can do in yoga or stretching or with regular chiropractic. So we're opening up that joint, and we're actually, and I didn't know this 30 years ago when I graduated, but it's now been federally researched, the study's been done. And it's a huge study. And even the author of the study said it actually sucks the disc back in. He used that word. And that's phenomenal. And I had one patient who actually got another MRI. We usually don't because we go over subjective findings. But she was 71 and we decompressed. She had a bulge of L5S1. Same radiologist read it a year later. The bulge was gone. And that would not have happened on its own. This is a degenerative condition.
Right.
So
Which is why I think the spine is particularly challenging because of the physical aspects. Because if you have misalignment or this compression, that sometimes is very hard for it to release, right? You have to do something that's mechanical. You have to respect. There's physics involved.
Yeah, there are lots of physics with this. And it's intuitive. So I know what I'm doing as far as feeling the surrounding tissue on you versus someone else, and someone who's larger, someone who's a sports, a professional athlete, professional bodybuilders, they're all different. And so we have to know the body. We have to have an MRI. And then when I see the changes and I feel it, the patient feels it feels great. So that's been for 30 years.
And you said there are only 3 providers in Arizona.
I think there's about 3 right now.
Why only 3?
Well, it's hard to do. It's not something you take a weekend seminar. There are 3 parts of it. You have to usually go to different parts of the country. It's not on a webinar. And the tables are very expensive. They started around $20,000 now. So why would you not just use a $400 bench when you have to do that? You know, it's a different lifestyle, actually, even for me. So I have my tables. I even have special people who have to work on those tables. It's not easy. And one of the repair guys calls them the Ferrari chiropractic tables because they're really kind of high-ended. But the patients respond well. And I don't think I've ever had someone not like the treatment. So that's what I do.
Yeah. Amazing. Are there, what are your other favorite therapies?
Well, of course, acupuncture, as I said, that is such a, almost like a silent healer, because it doesn't feel like there's much going on and patients don't understand, why are you doing this in my ear when my problem's over there? You know, they don't understand all of it. But
how do you explain that?
Well, meridians, and there's just specific points, and this is going to be for your chi or energy flow, and they get over it. Sometimes some are more painful, as you know, and that means that's the point we really need, you know, and they, over time, because I don't just do a one and done. So they usually get a course of care, and after a few visits, they'll get it. I even have one patient, she's 88. She's been coming to me probably 7 or 8 years now. And she'll say, I'm not sure this is working, but I keep getting it. Of course it's working. She's walking without a cane. She's doing this, she's doing that. You know, whatever we do, she's got more energy. She's not napping as often. And so she's almost afraid to admit it, because on her medical doctor's side, because she doesn't get her medical done in my practice, maybe she's hearing other things from other practitioners. I don't know, but she knows it's working deep down, and that's all that matters. So
yeah, the meridians are so interesting. I think they were, of course, the Western science is trying to dissect to say, where's the energy channel? I think that they're realizing that there are a flow of energies that are not anatomically, doesn't go along with anatomical structures. However, it's there. And what I heard, how the origins of these meridians came about was in ancient times. People meditate, right? People, in a lot of traditional cultures, they go inward trying to understand the physical world. What is this? Where are we at?
Because they can't see it, touch it,
so
feel
then
it.
They go inside. They use their mind's eye. I mean, this is all, woo-woo, right? But one day, I believe medicine and spirituality will merge, and we'll realize it is one and all. And
Western medicine. Because Eastern's already there.
That's true. Yeah. One day it's all going to merge. We're going to find language, because Western medicine, the problem is it doesn't have language for spirituality. It doesn't know how to explain it. So it can't verify. It doesn't know quite how to do it. And they're beginning to figure out, but it's maybe a different language. You may require to update your instrument or your language. So right now it's really hard to merge the two. But in ancient times, when they go inward, they literally see with their mind's eye of these energy channels. So the ancient Chinese have seen it. So there's a saying, seeing is believing. So if you see in your mind's eye, clearly staring in your face of all these energy channels, these meridians, then it's there. I saw it. And that's how they, started, I guess, utilizing those channels. And you were telling me in the beginning they were using blunt objects.
Blunt objects in the Stone Age. And then acupuncture has evolved throughout the ages.
So they were trying to press on the
and
acupuncture
that's when they found
points.
Things were working and things would improve and function improve.
It's so deep in Chinese culture. Like if you have nausea, so there's a point that you press. Or if you are, pregnancy, nausea. I mean, that's very common. You just press on this particular point on your hand, that nausea goes away. And I've tried it. I mean, not from pregnancy, but just from nausea. It's amazing. It works really well.
For seasickness.
Yeah.
When you get those little bracelets, that's acupuncture point.
Yeah. And even when we were in high school, I remember having a Chinese medicine doctor or just practitioner who was coming in and showing us all these points along the ears, right? So your ears, your hands, your feet has all the spots, control all your organs. Right? If you find the spot, it's connected to all your organs. So he was telling us what to press to help with our eyesight. And I mean, just it's part of and it
Yeah.
works because people see real results. So when people say it's pseudoscience, well, how do you contradict real results? Do you just bury your head in the sand saying, well, it doesn't exist? When it does exist, the better attitude is to say, oh my God, how can that happen? What do we not know? How can we try to explain this? Yeah. So you don't just deny reality. And that's what happens to a lot of doctors. They would rather just deny, saying, no, it's not real. Why don't you change your attitude and have some curiosity? Let's figure out why this could happen. So don't just say, oh, that's N of 1, because I've seen that. And it's really, really disheartening because doctors, these are the healers. These are people's guides to health, right? And if you close off your mind and then you become a stuffy,
know-it-all,
arrogant, then you can't guide people. Then you could be leading them down the wrong path. For example, I've seen the results of stem cell therapy, this intranasal treatment for dementia. And literally within a few months, I think it was 3-4 months period, a person, because in neurology or psychiatry, one way of testing their mental capacity is to draw a clock. So you draw the clock, you put your, the different hours and put the needle. Usually you ask patients to draw 10 after 10. So I saw the before clock, the demented patient, it was barely, it was not even round. It was strange shape and you can't see, and all the hours are like scooched to one side and the needle, you can't tell. It's a just terrible clock. Within a few months after the stem cell treatment, now we got pretty round clock. Now with the hours are in the right place, and it's wonderful. You can tell.
It's right there.
Yeah.
Right there.
So when I showed it to the psychiatrist who works in a famous clinic for brain health, and I said, look at this amazing thing, that this is what you can introduce to your patients if you do stem cell treatment. There's a chance for these severely demented patients to come back in their mental capacity. He looked at the clock and his comment was, oh yeah, but that's N of 1. So N is the number to treat, right? So his excuse of not looking further is that, oh, this is just one case. But to me, it's the first time I heard about how stem cells were helping this autistic kid, my response was, what? Yep. My goodness, how were you able to do that? How can you put some stem cells into this autistic person's veins and then he's making all these improvements where I can't after years of therapy with this autistic kid? What do you know that I don't know? What do these cells do that previously I haven't been able to tap into? That is the right response as a guide for people's health.
Yes.
So yeah, that just, unfortunately, I see that a lot. And you as a chiropractic physician, you probably have faced prejudice. Oh my goodness. One of a chiropractic doctor I've interviewed actually here is Dr. Ryan Manning. And, we've had, posts of him talking about the chiropractic care. I could not believe the kind of negative comments that were surfacing. I was like, where did this come from? Why is there such animosity? So I can't imagine
years,
you trying to provide care and how much negativity that you had to deal with.
I have. And like I said, over 30 years, and I still do today. They're still out there. And I think I saw that podcast and he was explaining how chiropractic, the actual industry, had gone to the they took the AMA to court and we won. And so no medical doctor can ever say chiropractic is not indicated, unless of course it's a fracture or there really is a contraindication, but you cannot tell a patient, do not go to a chiropractor. So that's really law. So it is what it is. It is still out there, not as prevalent as it had been over the years, but now I see it with regenerative medicine.
Yeah.
So I just shifted all of my focus to, I understand that. I know that there are people out there who are always not going to believe in something. And the reason I took the oath to be a physician was to keep healthy people healthy and to give them an alternative. And my article that I write in the newspaper is my health column, The Other Side of Your Health Story. So if a patient comes in and they have a shoulder problem. They've had an accident. They have the MRI that I had. And they say, the surgeon wants me to get surgery. I don't want that. I've had older women say they've been in a doctor's office, usually a surgeon's office. Surgeon closes the chart and says, there's nothing I can do, only surgery. The woman or the man, whomever, will say, I don't want surgery. There's nothing. And they walk out of the room. And the patient's left crying. What are they going to do? Where are they going to go? So I give them another side. Whether I'm writing about it in the paper, they're coming into my office. We're in my consult room. I show them, I do this similar situation like with chiropractic with informative video, information I have, models of the joints, explain what we're going to do, other testimonial, patients sharing. They can even call my patients or they'll call them and share their story. And it's a similar situation. So I give them the other side. Then it's up to the patient to make up their mind. They may walk out and say, you know what? I think the surgery will be okay. Or 99.9% of the time, pretty much 100, they'll say, I want to try this. So I've given them an alternative. That's all. But they make up their mind. I don't make them do it. I don't force them into any decisions and let people think for themselves. And it's been a really exciting career because now with stem cells, it is exciting and it is new and it's fresh.
How long have you been using stem cells in your practice?
About 18 years. I'm sorry, 20, about 8 years now.
8 years.
Yeah, not 18.
Okay.
No, 8 years.
Yeah. And what are some of the cases that stand out in your mind that you were even surprised by the results?
Another gentleman who, like my shoulder, bilateral shoulders, both of them were just about like my shoulder. And I looked, I thought, ooh, he was 78 years old.
Oh, wow.
He wanted to take, he's on my website for a testimonial. He wanted to have one more, he was a hunter. He wanted to go elk hunting. And this is my last hunt, he said. This is it. And both shoulders were so bad. Oh my goodness. Not that he had more forms to fill out, but we really had a heart to heart. His wife came into the room and I said, I'm not going to make promises, not that we promise anything, but this is going to be a difficult case. You're probably going to feel better, but you know, I had already gotten my results in 78 versus what I've done and our histories are totally different. He's on my website waving the arms around. This is what they do. I don't tell them to do this.
That's so cute.
He went on his hunt and I believe he got 2 elk. He did. And anybody who shoots knows that, and I'm sorry, he didn't shoot. It was a bow and arrow. It was a bow and arrow.
Wow.
It takes a lot of pressure. It takes a lot on the shoulder.
Yeah.
And that was why he kind of said, this will probably be the last one. That was I don't want to say it was a miracle, but it was a wonderful result that we got. And he couldn't wait to do a testimonial for us.
Oh.
Yeah, that was a real big one. And another one on the opposite end, because you don't have to be in your 70s or 80s or 60s or aging, older, degenerated joints. We had a 17-year-old girl come in. She was a volleyball player. She was a junior in high school at the time. It was June. And it was a weird move that she did. And she fractured one of her wrist bones and the lunate. And so what happened was she got an x-ray and they missed it. They missed the fracture. So by September, I believe that was when she got the first MRI. They put her in a cast from September to December. And then the surgeon did a surgery in December because nothing was getting better. So he did a surgery. And the second step was going to be to take one of her veins out of her forearm and put it into the wrist to increase vascularity. And her mother said, no. Dr. Leisa will know what to do because I've treated so many people in their family with chiropractic and gut health and nutrition and everything. She says, and I write for the paper, so she knows me. She says, let's go see Dr. Leisa. So she brings her daughter in March. And she said, what about stem cells? And we said, yeah, this is going to be a great case for that. So we did similar protocol to what I had, but she didn't get anywhere near what I did because of my situation.
So she got an IV and local injection?
She did not get IV.
Okay.
She did get a local injection of the stem cells and exosomes. We did the ozone and PRP, which really sets us out differently than others because they'll do PRP and ozone, but not in the order that we do and how we do it. It just works. And I know my colleague who does the research says, don't change your protocols that they work. So we did that for her and she went back. So that was over a 2-month period. She went back to the surgeon I'm going to say that was about 2 months later. She hadn't even gotten her second injection yet. And he said that she was 60% improved. And then after the second one, this was 3 months after he had seen her, she was fully released to play volleyball, and her life was better. And at this point now she was a freshman in college. And that's when she did she's a testimonial with her mom on my website. And you'll see the two of them together at 17. So you don't have to be 70, 80, 60, 50.
Exactly.
She's a young girl.
Yeah.
And the fact is that she had growth factors. She's young enough. Why didn't she heal? And what the surgeon was saying, she had what was called soft bones. I've never heard of that. But he that's the only thing he could wrap his head around, why his treatments weren't working. And when we did ours, he finally understood, okay, this is something different here. It wasn't 100% understanding, but it was good. And the bottom line is she's gotten her life back, and she's playing volleyball and doing anything she wants.
And the stem cells have angiogenic potentials, can help form new blood vessels. So he didn't have to transplant, take a vessel somewhere else and put it there. And it's never going to be as good as if your body is making its own, right?
Exactly.
It's got its own plan. It's following its own plan. It's beautiful. And that's, I love these stories because it really shows people the path of healing, because people may trust their doctor's ideas so much and discounting their body's own abilities.
Just give them the boost, give the body a boost and give it time. And just like they said to me, my colleague, if it doesn't work for whatever reason, use the surgery as plan B, not the stem cells as plan B. And every one of the patients that we have treated who have had the surgery and it didn't work and got the stem cells have wished they had gotten the stem cells first, but they didn't know about it and they weren't given that opportunity. And no surgeon even gave them the other side of their health story to say, why don't you go and consult with this type of a practitioner? And that's what's sad. But you know what? They're still feeling better. And the bottom line is the patient's where they need to be now.
Yeah.
So,
and what's interesting is, a lot of people are trapped in the medical system because their insurance will only pay for these doctors. So they think, okay, I'm saving money by seeing this doctor and following the plan because insurance is covering it. But if you have a surgery, you have all this downtime and possibly it's, causing future, side potential damages and that you have to address and you're not fully functioning, how much is that costing you? I mean, people, and really how much is your cost, your health worth?
Is worth money.
Yeah. And your health.
Yeah. Your health.
Your quality of life.
The downtime. Yeah. And I've seen shoulder surgeries. I mean, they can't even move their arm back, let alone do dips in the gym. Not everybody goes to the gym, but maybe you're stretching. Maybe you cook and you can't put the cinnamon back up into the spice cabinet. These are things you'll never do again. And they just sort of take it and live with that. And just trust more than just one surgeon's opinion. Trust your body.
Right.
Go for more than one stem cell consultation until it resonates with you. Think about it, meditate on it, whatever it takes. Ask your friends, ask people, talk to people who've done it. And yes, we're going to put all the positive cases. We really don't get negative cases. So that's why they're not on there.
Well, so one reason stem cell therapy, I mean, again, when it comes to legality, I mean, there's nowhere in the US that says stem cell therapy is illegal. And actually, there are quite a few states that are saying stem cell therapy is absolutely legal. You can practice here. Yeah, so it's, in a lot of states, it's in a gray area. But the beauty of the treatment is the same thing as ozone therapy, peptide therapy, or a lot of the nutritional therapies. There's nowhere, you're not going to find a law that says, yes, you can practice this. However, when you practice something, you better be sure it's safe. You're hoping that they're effective, but of course, effectiveness seems to be only determined by the FDA. They can say whether or not something effective. That's a whole other subject, but at least it's safe, right? You're not hurting your patients. And that's the beauty of stem cell therapy, that is so extraordinarily safe. Unless, of course, doctors can always make mistakes. You inject in the wrong place. You're not putting the right things into the body.
It's pretty simple. And I know you know that because you inject. I'm not the injector, but I'm in the room and I see how it's done. It's not that difficult. And I don't know how they could screw it up. It's pretty simple and straightforward. I think it's a lot more complex with the other things they're getting on the medical side, and how many hospital stories have you heard where they amputated the wrong leg, the wrong limb? That was
crazy.
Going in Rhode Island for a few years. There was a hospital, there were issues. And I know that because that's where I'm from. So that's a pretty big deal. And people dying on tables and not coming back from surgery. And the side effects from that. And I even had one patient, we counted the number of visits. She had some sort of an allergy to a medication prior to her getting a surgery in a very big teaching facility in our area. Over 30 visits before the surgery. And then she had the surgery. She couldn't drive for 2 weeks because she lived alone. Then she couldn't get acupuncture. I believe it was almost 2 months prior and 2 months after, because it was it was a needle, and they were afraid she could get some sort of infection. So her acupuncture was gone. Everything was upside down. Then how many months? It was 2 months of physical therapy, going to and from the physical therapist. All of that time, what did that cost her? Also, it was covered on Medicare. And that's the sad part. So look at yourself. I wrote an article. They're all on my website, and it was about what is your time worth, and is it really worth it to get surgery after? And I don't even remember the actual article title, but it's there, and what you have to go through for all of that. So just trust it, do it, and think of yourself. And just because it's on insurance or the FDA said so may not be the best for you, right?
Yeah. So. Yeah. I think if people are still stuck on that everything that's been approved by the FDA is safe, they certainly don't know the history of all the medications and all the medical devices that have been approved and how many horror stories. And and that's not even, I mean, the current medical system, it really is unfortunate because I'm sure you've seen the statistic. Medical errors is the third leading cause of death in this country. And these are errors. So we're not counting the doctors who are doing what they're supposed to do, right? According to the protocol, and how many people actually die from that. So, but those are not counted as errors. Errors means that they're really they just screwed up. They didn't follow the right protocol. Something was wrong. So it's
much higher. And people aren't taught that or told that prior to the surgery. Back surgery, I've been working with post-surgery, pre-surgery for 30 years. They were never told the numbers of what would be a failed surgery. That can go up to 76%. And I've asked every single patient, were you told that? No. Are you sure you weren't under half anesthesia when you signed the paper? No. And then they would say, they would have done it because they were in so much pain that their lives were almost over, that they would do anything to get the pain relieved, and then the pain wasn't relieved. And that's when it's a big problem. But no one ever told them it was up to 76% of failed back surgeries. Wow. I was never taught that in school. So what are you going to do? And that would be like jumping out of a plane, 76% chance that parachute's not
certainly
the
open. Doctors who are teaching us surgery, I mean, the supervising doctors and training doctors, they're not going to tell us that.
Those numbers are huge. It's not 2%. It's not 1%, up to 76%. And then you're talking, those are failures. Maybe those aren't even errors. We don't know. Yeah. So I don't know if it was segregated that way, because I was writing the article and I didn't even get in that deep to it. But just open your eyes. And just because it's not on insurance, yes, there is an expense involved. None of it is on insurance, unless maybe Medicare will cover the nurse practitioner's exam on you and your MRI, your imaging, that's it. Yeah. But otherwise, it's not going to be covered, and that's okay. Just know and get your lives back and start to heal. Remember the other things that were diminished before the actual arthritis or whatever, or the tear or the accident. Yeah. Let the other things heal as well. It just works so nicely.
Yeah, I think surgery is definitely one of the shining spots, for Western medicine, that we can go in, cut, and actually make things better. So that it's an amazing thing. It's always nice to know that we are good at it. We can do it. But comparing to what the body can do on its own, probably, I don't know the statistics, but possibly 80% of surgeries could have been avoided if you just give the body the right tools to heal. So there are definitely cases where you have to put the pieces back together. And thank God that we have these surgeons that know how to do it. And it's wonderful. It's wonderful to know that we have these amazing surgeons.
If needed, it is there. Yeah. But in many, many cases, we just said, including mine, it was an option,
Right.
but not
You were
necessary.
told in no uncertain terms
There was no
that you need
option.
that. And our mutual friend, Jeff Thurston,
Yeah.
was told by 2 orthopedic surgeons, oh, with your knees, absolutely, bilateral knee replacement. And he told me, well, I don't want it. So what can you do? I don't want artificial knees. So all I did, 1 IV infusion, some stem cells in each knee. This is 10 years later. He's 79
feeling
years
great.
old.
Yes, he is. Yeah.
I mean, doing amazing.
Raving
right?
about those injections.
Yeah. I mean,
Yeah.
he didn't need it at all. But when 2 separate orthopedic surgeons told him, absolutely, it's bone on bone, you have no other hope. And same thing with my other patients, plantar plate injury by 3 different podiatrists. Absolutely, you need surgery. He's like, I don't want to do it. Okay, let's do it. All I did was IV infusion. I did use some therapeutic ultrasound on the bottom of the foot, and the plantar plate healed up within 3 months. Did an Ironman.
Wow.
Yeah, this is
Isn't that great story.
right, and that just shows you. So if you listen to the doctors, then you think you only have one option, when you could have saved yourself. Not only you have no downtime, you could have had better results. And yeah, I think people deserve to know.
That's absolutely true. And just go within, or ask your friends, come to me, go to my website, go to your website, do your research.
Yeah.
There are other sides to every story. And when you do it and it works and you talk to people it's worked with, it's fun.
Yeah. So Dr. Leisa, how do people find you?
They can find me on my website, which is caringpainrelief.com. And we're right now in process of moving it over to more of regenerative medicine. That's happening now. My phone number at the office is 480-584-3955. And leave messages, get in touch with us. We'll get back. I always offer a complimentary consultation. So if you don't live within an hour of the practice, medical tourism is very popular. And I know patients come to me for the decompression that I do, for the Cox technique. But you can come. Scottsdale is a beautiful destination. You can golf. You can do a lot of things. And you can come to the office and from any place, as long as you can get on a plane and fly to Scottsdale, we'll be more than happy to see you.
How many sessions does it take? How many days?
For me,
for
well, it's
decompression?
over 2 months, but you wouldn't spend 2 months in Arizona. But if we can get you with all of the injections, those can be done within a week, maybe a week and a half, depending on my physician's time to do that.
But the decompression.
For the decompression, that's 30 to 40 visits for some people, depends on the severity of their condition.
Okay.
And maybe 20. It's not cookie cutter.
I see.
And they'll spend time. And if that happens, I've spent a whole month and they've come in every day for a month.
Wow.
Because they've got a place to stay or someone they know, or they'll rent something, and this is how it works. But and then they can go back home and they're in better shape. They're doing what they need to do.
Wonderful.
Yeah.
Lovely. Thank you so much,
you're
Dr.
so
Leisa.
very welcome.
It's such an enjoyable conversation. Thank you for sharing your experience, and congratulations on your wonderful healing capabilities.
Oh, thank you so much. And thank you for inviting me. I appreciate it.
Of course.
Fun.